This is Liam, Boo Boo Liam. I counted 22 stitches. It's going to be beautiful when it's healed. Today is the 24th, 30 days in April, so you're looking at about the 6th or 7th that these sutures can be removed. They are absorbable, but I like to remove them anyway because I don't like the knots to stay in the ears. Takes 10 days to heal. The sutures won't be absorbed for at least 60 days. You are to clean it with the Accept. Hold on, I'll show you what that is. Ugh. Okay, you're to clean it with this. Just skeet it in there like we discussed last week. It's okay if it gets in the ear and on the outside. I'm going to put this big size 25 head shield on him. You are to wipe the inside of this out with a moist, not wet, a moist paper towel at least once a day. You don't want this getting nasty. Anyway, when you're through cleaning it with the Accept, you're to go with the triple antibiotic ointment. Just old cheap Dollar General triple antibiotic ointment. You don't want HC in it because HC stands for hydrocortisone and that delays healing. You just want plain triple antibiotic ointment and put it in there when you're through cleaning. Other than that, we're going to put him on a little Remedil for any swelling and discomfort, and we're going to put him on some oral Keflex, also known as cephalaxin, to help prevent any infection. This is done at least twice a day. Then the ointment we discussed and the antibiotics will be twice a day, and the Remedil will be twice a day starting out, maybe for about 3 to 5 days. I've marked this off. I'm going to trim it back to where he can eat and drink, but he can't scratch the ear with his back leg or get to it in any way. You see where I've cut it back? Cut it back with these big old honkers right here. Harbor Freight came through again. That way you can get to the ear, and he can't get to the ear. Alright, I've already put this ointment on that cut. You can see where I fill that cut up with it. Alright, that's a beautiful job. You ought to be proud of that.